Hi there, I'm Casey. I'm going to be your nurse practitioner student doing your health assessment. I'm just sanitizing my hands here.
Nice to meet you.
Nice to meet you. So let's start with having you walk across the floor for me. Let's start off here, and I want you to walk like you normally would. All right, turn back around. I'd like for you to walk heel to toe. Turn back around. Walk on your tiptoes this time. All right, turn back around. Walk on your heels. All right, gonna have you stop right here. Can I get you to put your feet together? Arms out. Close your eyes. Okay, you can open them. All right, Romberg test showed no swaying and no imbalances. Gait was undisturbed. And even when you were walking, let me get you to close your eyes one more time. I'd like for you to run your heel down your shin. All right, you can open them again. Now we're going to do some range of motion exercises. Can I get you to lean forward? Lean back. Lean to your left. Lean to your right. Circle this way.
Which way?
Circle that way. All right, and now I'm going to have you turn this way. I'm going to look at your scapula, iliac crest, gluteal folds even symmetrically, and we'll turn back this way again. And I'm going to have you lean forward and touch your toes, and I'm going to check the curvature of your spine. Let me know if you feel any pain. Any pain?
No, ma'am.
All right, I'm going to have you take a seat now, and I'm going to inspect your scalp. Hair distribution even, no masses or lesions. All right, and I'm going to look at your face. It's clean, dry, and intact. Warm, no lesions or masses. I'm going to have you close your eyes for me. Let me know if this is soft or dull, what you're feeling.
Soft. Dull. Dull. Soft. Soft. Dull.
All right, cranial nerve number 5 is intact. And skin tone is normal for ethnicity. I'm going to palpate your temporal arteries. No thrills noted. Now I'm going to auscultate your temporal arteries. No worries auscultated. Here is when I would check cranial nerve number 12 or 2, but I do not have a Snellen chart. So we'll move on to the rest of the eye exam. All right, I would like for you to stare at that wall, and we'll check for corneal light reflex. All right, corneal light reflex is intact. I would like for you to look at that wall and watch my pen come in. Accommodation and convergence is intact. And I'm just going to look at your eyebrows and your eye structures. Eyebrows are symmetrical. Eyelids are symmetrical. Sclera is white. Conjunctiva is pink. Cornea looks intact. All right. I'm going to, actually, while I'm here, I'm going to palpate your sinuses and press your sinuses. Any pain?
No.
All right. All right. Now I'm going to turn out the lights. And I'm going to check for pupil reaction. Pupils are round, reactive, equal to light, both directly and consensually. I'm gonna look at your eyes now. Red light reflex intact. Retina's intact. Optic disc is yellow and well marginalized. No hemorrhages noted. I'll look at the other side. Once again, red reflex is present. No hemorrhages. Retina's intact. Yellow optic disc well marginalized. I'm going to turn the light back on. And from here, I'm going to have you follow my finger. All right, cranial nerve number 3 is intact from testing Perla, but also cranial nerve number 3, 4, and 6 just proved to be intact. Now I'm going to look at your ears. I'm going to switch my heads out real quick. All right. So inspecting rounded auricles, symmetrical in height, no lesions or masses noted, color normal for ethnicity. We're going to go ahead and test cranial nerve number 8. I'm going to step behind you. I want you to put a finger on your left ear and tell me what you're hearing.
September. Blue. 7. Purple. 13. Chloe.
All right, I'm going to have you switch your finger to the other ear.
Chloe. Purple. 7. 13. September. Blue.
All right, cranial nerve number 8 is intact. Next, we're going to check your the Weber test. Where are you feeling that, or where are you hearing it?
Both sides.
All right. Now I'm going to look into your ear. Now, if this was a pediatric patient, I would be pulling down and back. But it's an adult, so I'm going to pull up and back. Tympanic membrane is a pearly gray, light reflex present. There is hair on the first third of the auditory canal. Canal looks pink and moist. And I'm going to check the other side. Once again, tympanic membrane is a pearly gray. Hair on the first third of the auditory canal. Canal is pink. Light reflex is present. All right. I'm going to go ahead and have you close your eyes for me and close one nostril. Take a deep breath. What do you smell? Keep your eyes closed.
Rubbing alcohol.
All right, switch to the other side. Once again, another deep breath.
More rubbing alcohol.
Perfect. So that was cranial nerve number 1. All right. Next, we're going to check. I'm going to look and feel your nose. All right, nasal ridge is midline, no deviation. Skin is warm and dry. No lesions or masses noted. Now I'm going to look up your nose. All right, nasal mucosa is pink. Midline or turbinates are noted, well marginalized. Septum has no deviation. No drainage noted. And once again, nice pink, moist mucous membrane. Terminates noted, no deviations in the septum. All right, and next I'm going to have you puff out your cheeks for me. Grit your teeth. Frown. All right, cranial nerve number 7 is intact. Let me get you to push against my hand with your tongue. All right, good. Symmetrical tongue strength. Now I'm going to palpate for TMJ. Open your jaw for me. Close it, side to side. No popping or clicking noted. And I'm just going to have you open your mouth like you normally would. Lips are nice, pink and moist. Gums are pink and moist. Teeth are in good repair. I'm going to pull on your buccal mucosa is pink and moist. Tongue is resting midline, so cranial nerve number 12 is intact. Let me have you stick out your tongue. All right, cranial nerve number 9 and 10 intact, and just keep where you're at. Say "ah" for me.
Ah.
All right, you've raised midline. Tonsils are at +1, and cranial nerve number 12 is intact. So now I'm going to palpate your lymph nodes. We've got submental, submandibular, tonsillar, parotid, preauricular, postauricular, occipital, supracervical, deep cervical, posterior cervical, supraclavicular. Let me get you to shrug your shoulders. Good. And let me have you raise your arms up. I'm going to palpate for any lymph nodes here. No lymphadenopathy noted. And let me go ahead and get you to relax your arms here. Just normal. And I'm just going to inspect your skin on your neck. All right, looks clean, dry, and intact. Warm, no masses or lesions noted. And I'm going to palpate your carotids one at a time. No thrills palpated, no breathe auscultated. I'm going to have you lean your chin down just a hair bit. Going to feel for your trachea midline. Now I'm going to have you take a sip of water. I'm going to palpate for your thyroid. All right, and swallowing felt regular. All right. Next, I'm going to look at your skin on your arms. Skin is clean, dry, and intact. Hair distribution even on bilateral sides. Let me get you to grip my fingers here. Bilateral grip strength. Now I'm going to have you raise your shoulders out like this. Don't let me push you down. Push down on me. Perfect. Now arms like this. Push against. Pull. All right. Going to have you do some range of motion exercises. Pronation, supination, inversion, eversion, rotation, rotation. Wiggle your fingers for me and move that thumb. Good. I'm going to look at your nail beds. Nail beds are nice and pink. Cap refill less than 3 seconds. Warm and dry. No lesions or masses. Normal for ethnicity. Next, I'm going to try your brachial pulses. All right, +2 brachial pulses. Next, I'm going to check your reflexes. You just get comfortable. All right, next we'll check the tricep. +2 on that side. And we'll do this bicep and tricep. Once again, +2. Next, I'm going to check your brachial radial pulses. And then I'm going to check your brachial radial reflex. +2 on both sides. Next, I'm going to check your popliteal reflexes. +2. +2. Next will be the posterior tibial. All right, +2 for both of those reflexes. Next, I'm gonna look at your chest. Actually, no, I'm gonna have you push against my hands, pull against my hands. Good. All right, now I'm gonna move on to your chest. All right, I'm gonna check your skin turgor here. Both less than 1 second. Gonna percuss your lungs. All right, now I'm going to palpate. No lesions or masses noted. Warm, skin tone normal for ethnicity. Gonna listen to your lung sounds now. All right, I'm gonna have you scoot down this way and raise up this arm for me. And I'm gonna check for AP diameter here. AP transverse diameter is normal. And whenever you feel my hands, please say 99.
99, 99, 99.
All right, and let me get you to take a deep breath. One more time. Chest expansion equal on both sides, no rails, no heaves. Noted, now I'm going to percuss. All right, and I'm going to listen to your lung sounds back here, okay? I'm moving on to the lateral chest sounds. All right, no adventitious breath sounds noted on posterior or anterior chest. And I'm going to check for CVA tenderness. There's no accessory muscle used when breathing on posterior or anterior side. Any pain whenever I did that?
No, ma'am.
All right, and one more thing I'm gonna check real quick. Raise your arms up. Take a deep breath this way. All right, once again, symmetrical chest rise. Now I'm gonna have you lay on down. Scoot down just a hair. All right, and put your hands down by your side. I'm gonna look at your chest here. Just gonna watch your chest. No rails, no heaves noted. I'm going to palpate for your apical pulse, which is about should be fifth intercostal space, mid-clavicular line. All right. And next I'm going to auscultate your apical pulse. All right, regular rate and rhythm. I'm gonna next listen to your valves. So I'm gonna keep my stethoscope in. I'm gonna follow your clavicle to your sternal notch. And then we'll go for the aortic valve first. Then we'll go for the pulmonary, Erb's point, tricuspid, and mitral valve. Now I'm going to switch to the bell and listen to them again. Once again, following the clavicle to the sternal notch. Listen to the aortic. Now I'm listening to the pulmonary, Erb's point, tricuspid, mitral. All right. Next, I'm going to look at your abdomen. There's a rounded contour. Umbilicus is rounded, no disturbances, showing hernias. Skin tone is normal for ethnicity, no masses or lesions, or no lesions noted. And I'm going to listen to your abdomen. This time, starting in the right, or I'm going to start in the right lower quadrant. Epigastric. Next, I'm going to listen to your arteries using the bell. Aortic, iliac, renals. Bowel sounds are normal, active bowel sounds. No worries noted on the renal, iliac, or aortic arteries. I'm going to percuss your abdomen. All right, I'm going to do some light palpitation. Deep palpitation. All right, next I'm going to palpate for your liver and spleen. So you're going to feel me kind of reach underneath here. All right, take a deep breath for me. Let it out. All right, and we'll go to the other side. Checking the spleen. I just checked for the liver. Go ahead and take a deep breath. Let it out. All right, no organomegaly noted. Next, I'm going to look at your legs. So hair distribution equal, warm, dry, and intact, skin normal for ethnicity. I'm going to palpate for your inguinal lymph nodes, and I'm also going to check your femoral artery. All right, +2 on femoral artery, no lymphadenopathy noted. Next, I'm going to auscultate your femoral arteries. No worries auscultated. Next, I'm going to check your range of motion exercises. So let me know if you feel any pain or popping. So we're going to do flexion with the knee, abduction with the hip, abduction, internal rotation, external rotation, extension. Once again, going to do flexion, abduction, adduction, abduction, internal rotation, external rotation, extension of the knee. No crepitus felt. I'm going to check your for any pitting edema, no edema noted. Going to check your popliteal. All right. Popliteal is +2 regular. Check your posterior tibial. And dorsal pedis. Both of those are +2. Let me get you to bring your feet towards your head. Plantar flexion, dorsal flexion towards the wall, inversion, exversion, rotate, rotate the other way, wiggle your toes, good range of motion. Nail beds are pink, toes are warm to touch, nail beds, pink nail heads, cap refill less than 3 seconds. Now I'm going to check for Babinski. Negative both sides. Thank you so much for your time. We're done.